Hi, Assalamualaikum. I am Fatehah. In this presentation, I will share about seizure disorders and epilepsy. So, let's get started. So, how does it happen? So, a seizure starts with an excessive rate and hypersynchrony of discharges from a group of cerebral neurons that spreads to the adjoining cells, called the epileptogenic focus. Some seizures may be directly attributed to the factors that trigger the seizure, such as acute factors, hypoglycemia, hemorrhages, infections, fever, trauma, tumors, and anosmia. Other seizures may be attributed to the previous scarring and structural damage or to hormonal changes. Many seizures, especially in children, have no discernible underlying disease and are therefore idiopathic. There are two types of seizures, which are generalized seizures and partial seizures. So, for generalized seizures, it involves the entire cerebral cortex, which can be divided into tonic-clonic, absent, atypical absent, myoclonic, and atonic. As for partial seizures, it begins in a single location and remain limited or spread to become more generalized. It can either be simple partial seizures and complex partial seizures. So this is the most common type of seizure disorder found in childhood. However, an individual may experience both generalized and partial seizure, which is called a mixed seizure disorder. Of the generalized seizures, the tonic-clonic type occurs most frequently. A child having a tonic-clonic seizure may have an aura or sensation that the seizure is about to begin. This non-specific seizure can occur at any age and involve excessive neuronal firing from both hemispheres in a symmetric pattern. This is usually followed by a loss of consciousness, during which the body becomes rigid or tonic, and then rhythmic clonic contraction of all the extremities occur. The seizure may last for 5 minutes and is followed by a postictal period that may last for 1 to 2 hours. A second type of generalized seizure, absent seizure, is characterized by a momentary loss of awareness and the absence of motor activity except eye blinking or rolling. There is no aura, the seizure usually lasts less than 30 seconds, and there is no postictal period. The onset of these seizures occurs in the first decade of life. The characteristic of a child having an absent seizure is abrupt interruption of activity, a glazed look, stares, and unawareness of surrounding, which may be mistaken for daydreaming. Absent seizures. The other two mild forms of generalized seizure are myoclonic seizures, which consist of contractions by a single muscle or small group of muscle, and akinetic seizures, in which the primary problem is the loss of muscle tone. Children rarely have serious seizure for an extended period for 30 minutes or longer. These extended seizures are called status epilepticus and require medical management to maintain body functions and hydration. Intravenous anticonvulsant medication is also indicated to treat this condition. In complex partial seizure, usually originate in the temporal lobe. Children may show automatic reactions such as lip smacking, chewing, and buttoning and unbuttoning of clothing. These seizures are focal and the characteristics are similar to those of absent seizure. In addition, the individual may appear to be confused and disorganized and may have sensory experience such as smelling and tasting items not in the environment and hearing sounds of various types. As for simple partial seizure, usually involve the motor cortex and result in clonic activity of the face or extremities. Psychic symptoms include visual hallucination, illusions, auditory hallucination, or olfactory sensation. The typical seizure includes nighttime awakening and twitching of facial muscle. This twitching interferes with speech and spreads to the hand. Infantile spasms pose a serious threat to development. They typically begin at 6 months and disappear by 24 months. During this time, development appears to stop and skills may be lost. Early treatment with adrenocorticotropic hormone can inhibit the seizure activity. However, the effects of development are almost inevitable. More than 90% of children with known causes for their seizure have intellectual impairment. Anticonvulsive medications are administered in an attempt to control the seizure. In theory, these medications increase the intensity required to trigger the seizure or eliminate the recruitment of surrounding cells. Some of the common side effects of these medications, including cataracts, hair loss or gain, pathological fractures, vomiting, drowsiness, high blood pressure, liver damage, hyperactivity, weight gain, nausea, gum enlargement, and anorexia. The commonly prescribed medications include phenobarbital, phenytoin, etosuximide, carbamazepine, and valproic acid. Anti-epileptic medication is often withdrawn or reduced in dose if the child has been seizure-free with a normal EEG for at least 2 years. Withdrawal is done slowly and with caution, and healthcare workers are often asked to monitor the child closely during the withdrawal period. A number of anti-epileptic therapies based on old treatments are regaining favor as a result of a new research. One example is ketogenic diet, which consists of a carefully monitored intake of fats, sugars, and carbohydrate that force the body to use fat rather than carbohydrates for energy and alters neurotransmitters. The urine must be monitored to ensure adequate spillage of ketones. Short-term side effect includes metabolic acidosis and electrolyte disturbance, uric acid kidney stone formation, diarrhea, as well as vomiting. Surgical intervention is used if adequate control of the seizures cannot be achieved with medication. Surgical interventions that seek to cure epilepsy have been shown to be effective by reducing the seizure focus of the brain, particularly in complex partial seizures arising from the mesial temporal lobe. Hemispherectomy, involving removal of most of one side of the brain, is used for seizures that arise from multiple foci in one side of the brain and for progressive unilateral disorders. The timing for surgery is determined by the effectiveness of medication, seizure severity, and the impact of epilepsy on the child's functioning. That is all from me, and thank you for listening.